interstitial cystitis is? If you have interstitial cystitis, do you know how to prevent flare-ups? So if you want to learn more about IC, then continue to watch this video. This is a topic that is very near and dear to my heart. I actually got diagnosed with interstitial cystitis about 2 years ago. So keep watching to learn more. As always, this information is purely for educational purposes. This is not an intent to diagnose anybody. It's not an intent of, I'm not prescribing anything. I'm purely giving you educational material. So let's get started. What is interstitial cystitis? So it can be called interstitial cystitis. It can be called bladder pain syndrome. It's a chronic means that it lasts a long time. So it lasts longer than 6 weeks. It's a chronic bladder health issue, and it's very painful. It almost does feel like a UTI, but there's no UTI there. And you can also have pressure. So when it was first starting with me, I had a lot of pelvic pain, right lower quadrant pelvic pain. I even had to go get an intravaginal ultrasound to rule out cysts because they really weren't sure what was causing my pain. So you can have pain in the lower urinary tract symptoms, and they last more than 6 weeks, and there's not an infection or another clear cause. So as you see here, she doesn't look very happy, and her little bladder is inflamed and in pain. It feels like my bladder is mad at me. So I'm actually having a flare-up right now, which is why I decided to do this video. But with interstitial cystitis, I'm a registered nurse, and I have a master's degree in nursing education, and also I'm currently in school to get another master's degree in family nurse practitioner. I never learned about interstitial cystitis in my undergraduate education, and we barely skimmed over it in my education as a family nurse practitioner. So it's not very well known, it's not very well recognized. It took a while for me to get diagnosed. What was happening is that I was having a lot of pain, and I would go to the doctor, and then they would first I went to central care a few times, and they just wanted to throw antibiotics at me, right? Even though my urine was coming back negative. They're like, well, you don't really have any bacteria in your urine, but we're gonna go ahead and give you antibiotics. Which, if anybody knows, taking antibiotics repeatedly is not really healthy for your stomach. So I was taking antibiotics, I wasn't getting better. In fact, I was actually getting worse. Nobody really knew what was going on with me. I got that intravaginal ultrasound. Then finally, my gynecologist was like, okay, tell me a little bit more about your symptoms. And I think the aha moment for me was I was teaching some clinical students in post-conference, and I had just drank some coconut water, which I guess that coconut water had a little bit of citric acid in it, and the bladder does not do well with citrus. So I had just drank that coconut water, and my bladder felt like it was on fire. It was so much pain. I'm like, what's going on right now? I feel like someone poured gasoline in your bladder and just lit a match. And I was in so much pain. And again, I kept thinking I had a UTI. So I literally had to Google, what do you have when it feels like you have a UTI but your urine culture is negative? And the interstitial cystitis diagnosis came up. I didn't want to put anything in my provider's head, but then I saw that diagnosis, so I went to my gynecologist, and I told him, I'm having these symptoms, I was drinking this, and it got worse, and he's like, it sounds like interstitial cystitis. So then he referred me to a urologist, which is a specialist in regards to the bladder. So as you can see, there's an irritation in the lining of the bladder, of the mucosa. What causes interstitial cystitis? Well, long story short, they're not really sure. There's a lot of hypotheses, which are just some guesses. Some people say maybe it's a defect in the lining of the bladder that causes irritation, that it could be due to bladder trauma or overstretching. It could be an autoimmune disorder. I do have a lot of autoimmune conditions, I have asthma and allergies, so that kind of runs in with there. They're saying inflammation in the body, genetics, allergies again. So basically it's, some people unfortunately are just more predisposed to get things, and I was one of those individuals. One thing that I do want to tell you is if you got diagnosed with interstitial cystitis, don't blame yourself. It's not your fault, and it's just something kind of that happened to you. There's things that you can do to help yourself, but I don't want you to carry guilt around like, what if, right? So people every day do things and are completely fine. And, maybe for you it was some kind of trigger, but this is more of a allergic autoimmune condition. So be kind to yourself. And this condition is already miserable enough without you having to blame yourself for something. So I wanted to talk a little bit also, just going back, I wanted to talk a little bit about what interstitial cystitis feels like. Pain is usually the most common symptom, and a lot of doctors will think you're crazy, and it happened to me because I was in pain and my urine was fine. They're like, you're fine. We don't know what's wrong with you, right? You can feel pain, you can feel pressure. Not only do you feel pain in your bladder, but sometimes you can feel pain in like your vaginal area. So you may feel like a sharp stabbing pain in your vaginal area. You may notice that the pain gets worse before your monthly cycle, because what happens before your monthly cycle is that there's an increase in prostaglandins, and prostaglandins are associated with the pain sensation, which is why we actually take NSAIDs, like if we're getting cramps, a lot of women, we take Advil or Motrin. Those are non-steroidal anti-inflammatories, and they help actually block prostaglandins. So women, they may feel pain in the vulva or the vaginal region, and men may feel pain in the scrotum, testicle, or penis. This condition is more common in women though, which some people wonder if it has to do with like hormonal issues. The pain may be constant or it may come and go. Now for me, I was doing really, really well, but I'm in graduate school, and there's a low acid coffee that I drink. Maybe I can do another video on that. There's a low acid coffee that I drink because normally caffeine is out of the question for anyone with interstitial cystitis, and I did have to give coffee up for a long time, and I slowly started reintroducing foods back into my diet. But I'm in graduate school and I've been studying a lot, so I was drinking, like increasing my amount of caffeine, and then I got a little too, I guess, cocky. I overstepped my boundaries because I'm having a bad flare-up right now. So to the point where I'm going to have to cut coffee out again, even though I love coffee. I'm Colombian, so we love our coffee, right? So treatment for interstitial cystitis, there's really no cure as of right now. I've read studies where in Canada, they're doing installations in the bladder with like hyaluronic acid and things like that, but it has not been approved yet in the United States. If someone is watching this video and something cured your interstitial cystitis, and maybe you're in Canada or South America, please let me know. What we can do right now if we live in the United States is symptomatic treatment, which basically is treat the symptoms. So avoid triggers that, unfortunately, it's a lot, especially as a Hispanic. I love spicy food, I love my caffeine, and known triggers of interstitial cystitis are citrus fruits, tomatoes, chocolate, coffee, sometimes alcoholic drinks, caffeinated beverages, spicy foods, carbonated drinks. So, and it doesn't mean that you have to cut out these foods completely. Just start cutting them out and then slowly reintroducing them. So you want to avoid triggers. There is a medication that is approved by the FDA for interstitial cystitis. It's called Elmaron. However, I just checked today and it's $892 for a month's supply without insurance. And a lot of insurance companies do not cover this medication. It has a few side effects, which it can cause your hair to fall out, it can cause nausea, it can cause headaches, and it can cause optic neuritis. Optic neuritis basically means it's an inflammation of your optic nerve. I didn't even check to see if my insurance company will cover this. Most people say that it does not cover it, but the whole vision thing really scared me. But you have to take Almiron for 3 to 6 months in order to start seeing improvement. And it helps around 30 out of 100 people. Pre-leaf, this saved my life. I have it here. I'm not getting any kind of compensation for it. I know there's a little bit of a glare, but this really helped me. And pre-leaf, what it basically is, it's something that is sold over the counter, and it helps neutralize some of the acid in the foods that you eat or in the beverages that you eat. For me, my triggers are mostly beverages. So like I can't drink orange juice, I can't drink lemonade, like I have to just drink water basically. But it has calcium glycerophosphate, and calcium glycerophosphate neutralizes acids in foods, and taking pre-leaf before eating acidic foods can help reduce or relieve symptoms in patients whose medical conditions are exacerbated by acid consumption. It does come in a tablet. This is a tablet form, or it comes in a powder form. This has been primarily what I have used, and it's worked really well for me. This brings 300 caplets, and I think it was around $20 to $30 on Amazon. I highly recommend this. You need this if you have interstitial cystitis. There's a few other supplements, and again, always check with your primary care provider before you start on any kind of supplement. This is only for educational information. I'm not telling you to go out and get this. I'm just telling you what's helped for me. So I am just starting this one. Honestly, I don't think it's helped that much. This is called Cysto Renew. I haven't really felt that much of a difference. Cysto Protect is this one. This one they sell on Amazon. This is a little bit pricey, and you can't take this if you have allergies to shellfish, crab, or shrimp. They also recommend marshmallow root. This is marshmallow root, and it's basically an herb or a plant. Remember that just because something is over the counter doesn't mean that it's completely safe to use. So again, always talk to your healthcare provider. But pre-leaf by far has helped me the most. And this Cysto Protect helps me when my bladder is just really angry and I need to calm it down again. Yeah, and other than that, unfortunately, just limiting triggers. Oh, definitely heat. I'm sitting on a heating pad right now because heat helps decrease the pain that you feel. So you could put it, I sit on it when I'm doing work, like homework, or you can put it on your belly, on your lower abdomen. I added a few extra interventions or treatments. But what I basically was trying to say earlier is that if you're going to go to the doctor and give a urine sample because you're not sure if you have a UTI or if it's a flare-up of interstitial cystitis, I do not recommend that you take Pyridium because it's going to throw off your lab results. What you can do is they do sell over the counter, they sell urine strips. So you can test your urine before you go. A few ways to tell that you definitely have a UTI is if you're having blood in the urine, if after you void or pee, you feel like your bladder is still contracting, if you notice that your urine is foul smelling or foamy or frothy, those are more symptoms of UTI. Now, you have a severe UTI if you're having fever, things like that. Remember that with interstitial cystitis, you don't have an infection, so you're not going to get chills or any type of things you may feel when you have an infection. There's nothing wrong with being safe and sorry if you feel like you want to go to the doctor to make sure you don't have a UTI. That's completely fine. It took me a few visits to the doctor before I could kind of tell, like, no, this is a flare-up. I don't have a urinary tract infection. But again, so interventions that you can do, we discussed heat, also stress reduction. So deep breathing, going for a walk, the more stressed you are going to increase inflammation in your body. And then exercise, you can do yoga, like yin yoga, or any type of exercise really. When you first have a really bad flare-up of interstitial cystitis, even running hurts because your bladder, imagine, your bladder's here, and if you have fluid bouncing up and down, it may irritate it more. So you can try stationary exercises. So things like yoga is really good because you're not jumping up and down. As you get better, the pain may be less to the point where you can jump, you can run. And remember, don't lose hope. I did read something encouraging that up to 50% of individuals with interstitial cystitis, sometimes it can just go away. Remember that medicine is always evolving, so hopefully one day they do figure out what's causing it and they do find a cure. Thank you so much for watching. Make sure you hit the like and subscribe button if you learned something today, and if you like something, and if you struggle with interstitial cystitis, leave a comment.